Ladies and gentlemen, welcome to my presentation. My paper is Self-Esteem and Psychological Distress Among Students with Special Educational Needs in Tertiary Education. I'm Dr. Anam from Research Unit of Love, Marriage and Family, School of Humanities and Languages, St. Francis University, Hong Kong, China. The study is supported by the institutional film-based grant of the St. Francis University. How do we define inclusive education? Broadly speaking, all students, regardless of gender, ethnicity, culture, social background, have their rights to participate in common learning activities within the ordinary school system. And narrowly defined, all students with disabilities or special educational needs are entitled to study in a regular school setting. There is an assumption for inclusive education. Participation in IE environments enhances academic performance, social relationships, and emotional well-being of students with SEN. And there are two kinds of format of education. First one is integrational uh, education, and the other one is inclusive education. For the integration one, that means placing the SEN students in mainstream classrooms without providing tailored supports to address their special needs. An inclusive one means ensuring that students with SEN receive individualized supports, adapt curricula, and collaborative teaching strategies that cater to their special educational needs. And according to the literature, there is mixed outcome of inclusive education. The recent meta-analysis and systematic reviews indicates that IE has not consistently promoted mental well-being, academic achievement, and positive self-concept. The focus of previous studies are mainly on primary and secondary school students, and then the SEN students in tertiary institutes remained under investigated. For the policy of Hong Kong's inclusive education, since 1970, it's been hindered by the elitistic system, and it's been reactivated in 1994. The Salamanca statement developed during the World Conference on Special Education, on Special Needs of Education. And for the situation in Hong Kong about inclusive education, first of all, we are adopting the whole school approach, and there is a double-checked reference system for mild to moderate grade. They will go to the mainstream schools, and for severe students with SEN, then they will be sent referred to they will be attending the special schools. And also for the service training for the teachers, there are 3 tiers of training. The basic course is 30 hours, and the advanced course is 102 hours, and the thematic courses are 120 hours. But then the teachers still think that it's too brief to adequately train them, and teachers lack confidence in teaching students of SEN. While teachers feeling inadequate in the IE training, students with SEN show high levels of anxiety about school life, and they develop poor self-concept and also show withdrawal from social interaction. And of course, when we're talking about tertiary education, only a small portion of students with SEN are admitted to the publicly funded universities, and most are admitted to the private self-financing institutions. Only about 14 or 15% of SEN students are joining, students with SEN are joining the public universities, and more than 4/5, that is around 85% of them are admitted in the private institutions. So students in private higher education show lower academic self-concept and global self-esteem. And here's the figure showing the percentage of students being admitted to the higher education institution as highlighted in blueprint here is more than 80%. It ranges from 82 to 87% of the students joining the private um, self-financing institutions of higher education in Hong Kong. Um, of course, it's obvious that the transition from secondary school to tertiary education can cause academic stress, and also the academic demands might cause similar difficulty for students, especially with special education needs. So they have to cope with the disability as well. And in the one of the university, we try to monitor the mental health status of students initiate at the beginning of the year 2018-2019 academic year, and administered consistently in each subsequent year. So the demographic characteristics, SEN status, types of disabilities, and also the Rosenberg self-esteem skills and DAS 21 are being included in the survey. The DAS 21 means depression, anxiety, and stress level scale. There are 21 items. And then for the students with SEN, we'll include question related to types of disabilities. And there are 9 types of disabilities, and we further classify them into 3 types. Type 1 is the disabilities related to physical and sensory impairment. Physical disabilities, visual impairments, hearing impairments, and speech and language disorders. And type 2 is compromised, including those learning difficulties and developmental disorders. And these students with special learning difficulties, such as attention deficiency, hyperactive disorder, autism spectrum disorder, and developmental coordination disorders. And the type 3 refers to mental and emotional problems. And what about the supportive services in the institute then? In 2018 to 2019, there is no supportive services available. At least there's no systematic supportive services. And then in 2019 to 2020, the institute established unit for learning achievement and to provide different kinds of supportive services, including counselor services, tutorial services, specialist consultation, case conference, and comprehensive support, and some coping workshops. And the objective of the study is to evaluate the effectiveness of supportive services in promoting self-esteem and diminishing psychological distress among students with SEN. And second, to compare mental health status between students with and without SEN. And also the third one is to compare the changes in mental health outcomes over an academic year between the integrated and inclusive cohort. We use the annual student survey as our data for analysis. So it's been documented data in the 2018 to 2019, as well as the academic year of 2019 and 2020. So all these students underwent assessment at 2 distinct time points. Time 1 is the commencement of the academic year, and time 2 is upon the completion of the academic year. And we find that there's no statistically significant differences in the demographic profiles, disability type, and mental health status among these 2 years. And for the 2018 to 2019 students of SEN, their self-esteem declined significantly. Depression, anxiety, stress of the DAS 21 increased significantly. And non-SEN, students with non-SEN demonstrated no statistically significant change. Then in 2019 and 2020, for students of SEN, the self-esteem declined, but less significantly, and there's no change in the DAS-21. Again, for non-SEN students with non-SEN demonstrate no statistically significant change. So students of SEN consistently show lower self-esteem and higher psychological distress than their peers without SEN. Negative perception of inclusive education. It is being described in the literature that lower self-esteem and elevated psychological distress may be happened because of there is negative perception of the IE, and it's been linked to their negative perception of IE. And of course, students of SEN often perceive the settings as isolating, unreliable, or stigmatizing, whereas non-SEN students will not think in that way. And for contextual and experiential factors, the initial vulnerabilities amplify the negative perception of our students of SEN, and that might cause the effects of identity-related stigma as well. And there is causing this ineffective implementation of inclusive education. What about the role of supportive services, which was introduced in 2019 and 2020? We find that the results indicate that for implementation of these services, you find that the decline of self-esteem can be eased off, and then also the psychological distress is also being contained at a stable level without falling off further. So this is something encouraging to see the results or the outcome of supportive services. And we find that in the literature, there is quite a lot of study about the global self-esteem of students of SEN, social factors and peer dynamics. So students of SEN often engage in unfavorable social comparisons that can lower their self-esteem, and bullying or discrimination have been consistently linked to diminished self-esteem and heightened psychological distress among students with SEN. And there are other literature showing that social isolation compounds vulnerabilities of students of SEN by restricting opportunities for peer affiliation and positive identity development. And the other factor is family dynamics. So the harsh and authoritarian parenting practices undermine the development of secure self-concept, according to the literature. And what about the self-esteem of our students of SEN? There are 5 points to be highlighted. First of all, supportive services such as coping workshops or case conference do not fundamentally alter students' global self-esteem. Though such services may mitigate situational distress. And then students with special education needs with lower self-esteem often exhibit inadequate personal coping resources, which reduces their ability to manage academic demands and resulting in poorer academic performance. And third, addressing declines in self-esteem requires competence-building interventions, such as strengths-based feedback, mastery experience, peer tutoring, and structured monitoring that specifically focus on enhancement of academic competence to improve academic performance rather than focusing on self-concept set. And fourth one, strengthening academic competence is recommended to foster a more positive academic self-concept, which may subsequently generalize to global self-esteem. So self-esteem is traits-like characteristics, which is harder to change after all. So that's why we can see after the supportive services being intervened introduced, the self-esteem still show decline, but it's to a less extent. But then again, we find that the competence building intervention can help to at least to diminish the decline of the self-esteem. So for the psychological distress, if there is just an integration education, we can't see the effect of reducing the psychological distress. But if we include the inclusion education with some supportive services, then the psychological distress can be decreased. So these supportive services include tutorials and coping workshops. And the mechanism of supportive services include fostering a sense of belonging, reducing stigma, providing responsive accommodations, coping workshops through the observation and learning or internalization of experience of others. So in the workshop, the students can gather together and learn and reflect together about how they can adapt to the new learning environment in the school setting. So that helps them to enhance the coping strategy and collectively contribute to the containing psychological distress. And for the support from teachers and students with non-SEN, this whole school approach intervention, the teachers and students with those non-SEN students who can attend training workshops and case conference together, and also teachers may also find the training workshops effective in developing or helping them to develop a more accommodating and appropriate teaching methods. And students with SEN may develop a greater understanding of their peers with SEN, thereby fostering improved peer relationships for students with SEN. Because when we do the promotion for those workshops, we won't just promote to students of SEN, but it's a whole school approach. We will send the workshops to the whole school, all the students, and then also to the staff so they can join. And there won't be any highlight about who is with SEN or not with SEN. They just learn together. So such that this kind of approach or different parties and they can just learn from each other and to develop a better understanding of each other. To conclude, document data showing that students of SEN report significantly lower levels of self-esteem and exhibit higher levels of depression, anxiety, and general stress compared with their peers without SEN. It is essential to consider multifaceted factors, including contextual influences that extend beyond the immediate IE setting. And third, an IE setting that lacks adequate supportive services may fail to foster self-esteem or mitigate psychological distress among students of SEN. And fourth, the provision of supportive services plays a pivotal role in mitigating mental health challenges among students of SEN. And fifth, competence-based educational programs recommend to promote global self-esteem and social-emotional competence among students with SEN, while target interventions to strengthen the coping resilience are advised to mitigate psychological distress among students with SEN. So these are the references of our study. Thank you.